Hello everyone, my name is Pradyumna Kulkarni. I am from TYBSc Zoology. My roll number is 632 and my topic is thalassemia. Let me introduce you to thalassemia. The thalassemia is a blood disorder passed down through the families inherited in which the body makes an abnormal form of hemoglobin. Hemoglobin is the protein in RBC that carries oxygen. The disorder results in large number of RBC being destroyed which leads to anemia. Definition of thalassemia. Thalassemia is an autosomal recessive genetic disorder. It results in underproduction of normal globin proteins. It is often through mutations in regulatory genes. In this slide, you can see the malformed red blood cells. Next one is types of thalassemia. The thalassemias are classified according to the affected chain. The first one is alpha thalassemia. The second one is beta thalassemia and the third one is delta thalassemia. The beta thalassemia has three types: beta thalassemia major, beta thalassemia intermedia, beta thalassemia minor. Signs and symptoms of thalassemia. Signs and symptoms of thalassemia includes heart problems. Diseases such as congenital heart failure and abnormal heart rhythms may be associated with severe thalassemia. Iron overload. People with thalassemia can get overload of iron in their bodies either from the disease itself or from frequent blood transfusion. Too much iron can result in damage to the heart, liver, and endocrine system. Bone deformation. Thalassemia can make the bone marrow expand, which cause the bones to widen. This can result in abnormal bone structure, especially in the face and skull. Bone marrow expansion can also make bone thin, brittle, increasing the risk of broken bones. Infection. People with thalassemia have an increased risk of infection. This is especially true if the spleen has been removed. The skin appears to be pale and yellowish. Anemia. The Hb level will decrease depending on to the mild to severe form of thalassemia. Growth. Anemia can cause child's growth to slow. Puberty also may be delayed in children with thalassemia. Enlarged spleen. The spleen aids in fighting infection and filters unwanted materials such as old or damaged blood cells. Thalassemia is often accompanied by the destruction of large number of red blood cells, and the task of removing these cells causes spleen to enlarge. If there is severe enlargement of spleen, then its removal becomes necessary. Now let's move on to the diagnosis. CBC, complete blood count. Red blood cells that are varied in size, shape than normal RBCs may have uneven hemoglobin distribution. Special hemoglobin tests, it can evaluate the level of hemoglobin in RBCs. Genetic tests. DNA analysis done to diagnose thalassemia or to determine if a person is carrying mutated hemoglobin genes. Prenatal testing. Testing can be done before baby is born to find out he or she has thalassemia and determine how severe it can be. Tests include chronic villus sampling. This test usually done around the 11th week of pregnancy. Amniocentesis. This test usually done around the 16th week of pregnancy involves taking a sample of fluid that surrounds the fetus. Treatment of thalassemia. Treatment of thalassemia includes blood transfusions. It is often necessary to elevate the levels of hemoglobin above 8 gram per deciliter. Iron chelation therapy. Medications with difromexine are taken as daily injections while difropronine has the benefit of being an oral medication. Common side effects include nausea, vomiting, and diarrhea. Folic acid supplements can also be given. Bone marrow transplantation can also be done. Thank you for hearing my presentation.